Again, how many thoracic vertebrae are there? 12. Primary or secondary curve? Primary curve, right? So it's in the direction of the fetal position. Good. So let's go over some of the main typical features. Letter A, highlight this one. Vertebral body, you're going to find it, but it's going to be heart-shaped. Heart-shaped. Take a look up here for one quick second. Here's the vertebral body of a thoracic vertebrae. Notice it's kind of like a heart like this, right? Heart-shaped. So it's going to be more heart-shaped in appearance. The pedicle and the lamina, you don't have to highlight. Those are typical. Now, highlight letter D. Vertebroforamen is going to be smaller than the cervical spine, and if you could just add and round, it's going to be smaller than the cervical spine, which I have already. Just add that it's round.
Where is B?
And the shape is round.
What else? And vertebral body. Okay.
All right, so heart-shaped body, a small, round vertebroforamen. Let's skip over letter E for a second because I want to talk about that. Highlight letter F. The spinous process is going to be long, but watch this for a second. Take a look at me for a minute. This is the spinous process of a thoracic vertebrae. Which way is it pointing? Down. Guys, this is classic thoracic vertebrae. If I was sitting at a test and I was in your position at one time and they asked me what vertebrae this was, I would say heart-shaped body, good, small round vertebroforamen, I kind of have an idea. Then I see this downward sloping spinous process. I'm ready to bet the ranch. I'll bet it all. It's a thoracic vertebrae. But there's even a couple other things on here that will assure that I am correct as a thoracic vertebrae. Okay? But just those three things: heart-shaped body, small rounded vertebroforamen, downward sloping spinous process. It's got to be thoracic. And take a look at the spine that I put on your table. Look at these spinous processes in the thoracic spine. See how they're practically touching one another. That's how downward sloping they are. That is classic thoracic vertebrae. Classic, classic. Okay? So, let's talk about what's especially unique to the thoracic vertebrae. Each thoracic vertebrae has a pair of ribs attached to it. So there has to be some mechanism to attach the rib to the thoracic vertebrae. If you find them, then you know you have a thoracic vertebrae. So if I can just get your attention up here for one quick second. This is a thoracic vertebrae from the side, right? Downward sloping spinous process, we can kind of tell that. So watch this, guys. On the body, the back part of the body, you're going to see a rounded, flat area. We're going to call it a costal facet. Real quick, costal always means ribs. You hear the word costal, think rib. What's a facet? Flat joint, all right? So watch this. There's a flat joint on the side of the body, this side and the other side. That's going to receive the rib. I'll show you in a minute. That is called the costal facet. Then, check this out. The rib is going to attach here. Then the rib is going to do something interesting. It's going to come backwards and then go front to the front of your body. It actually swings around. It's going to touch the transverse process also. So again, I'm not sure if you can pick it up. Here, I can see it a little bit. I can see it on my computer better. There's a flat area on the transverse process that's going to receive part of the rib. That is going to be the transverse costal facet. So again, the name costal facet implies the rib is going to attach there. Let me show you how this works. You're going to look for those in a minute, but let me show you how it actually works. Let me go forward a second. Here we go. Watch this. We're looking down at the thoracic vertebrae. This is the rib. So watch this, guys. This part of the rib right here is called the rib head. It attaches to the costal facet on the side of the vertebrae. All right, so that's what's going to attach there. Then watch this. The rib goes backwards. The rib will have a bump on it. That bump is called the tubercle. That tubercle is going to touch the transverse process at the transverse costal facet. So the rib touches in two places. So what I want you to look for now, I'll come around and help you, is a costal facet on the side of the body and a costal facet on the transverse process. Okay? Get your pointer out. Oh, in your box also, I meant to tell you, if you didn't take it out, there's a rib also. See if you can get it to stick together. I'll show you. I'll give you a minute or two.
This one?
What's that?
It has time.
Oh, no, actually, I can demonstrate something. Figure it out. Good. Nice.
Maxilla. Maxilla. Did you get it? Oh, maybe because I start recording. Maybe because I'm recording. Maybe for that.
I'm looking for mine.
I'm coming.
I'm looking for mine. My busted up ones. I'm looking for my busted up bones.
Figure it out.
What?
Is it one of these that we're supposed to put in?
What was your question?
What is the lumbar? What is it this?
Oh, I can tell now. I can tell in the video when I watch it on my phone.
I'm looking for my silver bones.
It's the big one.
Oh shit.
We figured it out, see? Doing puzzle here.
Hi, mommy.
¿Cómo estás?
Bien.
Oh, look at the size of that rib. I'm just gonna sneak over here for a second.
Oh, sorry.
That's perfect. Just there's a little bit of a gap like that. See that little space there?
Oh.
Yeah. And this is a big rib, but it actually goes like that. So this is the costal facet, and then hold it for a second like that. I guess that would be the transverse costal facet. Let me get my other one.
And this is the lumbar, right?
That's the thoracic.
Oh.
Small. First is
On this vertebrae here, see that that little indentation right there?
Oh.
That's a good one. Yours is not that great. Let me see what you got. Yeah, you got one right there.
Professor, where is it located?
the thoracic.
That's thoracic. I think the
In the middle.
Ah, that one we don't know yet.
I don't know if it where this is in the middle, but it's in the middle somewhere.
Should be something like around there. Or in the middle.
And
No, this one, look, the
and
middle
the
one.
thing, what is the long thing?
Push it in between it, right?
What long thing? The wrist?
Yeah, the thing the professor had in his hand.
Oh, she has.
Can I have that for a second, yeah, please? Where is it located? Like,
Right here. There you go. Hold on. What do we say? Wait.
he said something like this.
Espérate.
No, like this.
Ah, like that. No, the other way.
Like that.
Like that. He says a gap right there. So this one, hold this, please. Hold this.
Brings it to the front. They don't come all the way around. So we call these costal cartilages. Costal cartilage.
Leave an arrow.
That's perfect right there.
Yay.
Okay, good.
The narrow. Like that.
Fractured where the cartilage makes the bone. It separates right here.
So how does it heal?
How is it?
It takes a sweet ass time, especially if you're working here, because this
Huh?
is the
Don't remember how to do
but you're better off breaking
Yeah, but this doesn't fit it, so it won't go like exactly.
this.
I had a friend who practiced one time. And he,
Oh, we didn't talk about that. Yep.
that means they have their PhD. So that's not their career, but they're considered.
It's stupid. Are you a doctor? Like a official doctor?
I'm not a medical doctor. My clinical training was as a chiropractor originally.
So
And then,
you got his
Do you
degree.
still practice?
no, 30 years I practiced and I was in retired. Just teaching it.
Ready, guys? So watch this.
Geology teacher. His name was Dr.
Ready? Costal facet on the side of the body, transverse costal facet. You got to say the whole name. That's for the tubercle of the rib. So you guys seem to do good on that. So watch this. Let me go back to our notes for a minute. Go back. I want you to highlight this time here. Letter E. The transverse costal facet, E1. Highlight that because that's unique. And then A1, just costal facet for A1, highlight that because that's unique also. Those are the things that are unique. Again, heart-shaped body, small, round vertebral foramen, downward sloping spinous process, the costal facets and transverse costal facet, you know you have a thoracic vertebrae. Yes?
Okay, so. Alright, so this is the.
Okay, guys, the last part of the spine we want to do is the lumbar spine. So here's good news. With the lumbar vertebrae, we know everything there is to know. I have nothing unique. So do me a favor, grab the biggest vertebrae on your ring. Grab the biggest vertebrae on your ring. Take a look at it. What makes the lumbar vertebrae a lumbar vertebrae, look how big it is. Everything is just massive. Take a look at the body. It's freaking gigantic, right? It's kind of like oval shape, but it's big. It's got a vertebral foramen. It's got all the parts that you need, that you typically can find on a vertebrae. They're just going to be bigger. So to identify the lumbar vertebrae, it has all the normal parts. They're just bigger. Think about it. If you weighed 120 pounds or 150 pounds or 200 pounds or 250, whatever your weight is, that lumbar vertebrae has to hold the weight of your body. So the vertebrae is much more massive, okay? So on your ring, the biggest vertebrae, let me see your lumbar vertebrae for a second. Here. Yeah, just take a look at the difference, right? The vertebrae here, look how big it is, the body, right? Even the spinous processes, they're kind of like blade-like. They kind of remind me of dinosaurs. Have you ever seen at the American Museum of Natural History, the big spinous processes that stick off, they're kind of blade-like on a dinosaur? Ours look like that. So for a lumbar vertebrae, if you saw this sitting at a desk, it has all the normal parts. They're just massive. It's got to be a lumbar. So, yes? Thoracic. Costal facet. Transverse costal. Okay? All right, so here's a test. Take a look up here for a minute. In your mind, I want you to distinguish the three vertebrae. In your mind, which or which? Take a look at that for a couple minutes. What's letter B? Thoracic. Why? Heart-shaped body, small, rounded, transverse foramen. We can't see the spinous process, but what's the direction of the spinous process? Downward. What's this little bump right here, a little indentation? Costal facet, but which costal facet? Transverse. Over here would be the costal facet. So this was, you got it right on the test. This is exactly what you got to do in your mind. What's this vertebrae? How come? Small body, large, right? Large vertebral foramen. Transverse foramen, the bifid spinous. Those are classic cervical. You got that one right. That means the last one is, letter C is the lumbar. Okay, everything but just big. All right, so that's a couple stations on my exam. That's what you got to do in your mind. You got to just, you got to process it. You got to kind of figure out, what am I looking at? Okay. For those of you, sometimes students I find like a chart format. Guys, just listen up, please. This is not in your lab book. This is actually in your textbook. This has all the information that's in my notes. It's just in a chart, so sometimes it's a little bit easier to look at it. Here's the features of a cervical vertebrae, the features of the thoracic, the features of the lumbar. If you want that, just photocopy it out of your textbook and you can put it in your lab notes. You have all the information. It's just I know some students like to look at it that way. I think they did a good job with it. So this is in your textbook, not the lab book. Okay. Okay. Take out a bone that looks like this.
That was some fun, right?
I think I cracked this one time. What?
Here's the gluteal, right? The
Everybody
gluteal
have?
part,
Okay, guys.
the buttock.
This is the sacrum. So there's a couple things I want you to know. Again, I'm going to ask you questions on the next test too, in addition to identification. This was originally 5 vertebrae that fused into one. All right, so it was 5 vertebrae that became one. It's a triangular bone. So watch this. This part here that's flat of the triangle, we're going to call the base. The pointy part of the triangle, what's the pointy part of a triangle called? Apex, right, from geometry class. If you ever took geometry, the apex is the pointy part of a triangle. So the base and the apex. Just so you know, the base sits superior like this. The apex faces down. So in your body, the sacrum, the sacrum sits like this. Okay, base is up, the apex is down. How do you tell the front from the back? The front is smooth, like this. The back is all lumpy bumpy like this. Okay, so you need to know the front from the back to get your answers correct. Front is smooth, the back more lumpy bumpy. Let's take a look at the front. If you have your sacrum out, the front, here's the first landmark, which is kind of followed down the notes. This rounded part right here, this is called the sacral promontory. Right? It's prominent, it kind of sticks out. So this is the sacral promontory right there. Where my pointers are now, these are the ala, A-L-A. Ala means wings, so they're kind of like the wings sticking out of the sacrum. So the sacral promontory and the ala. Questions on that? Okay, go to the back. Now, depending on your model, you may not be able to see this. If I took my stick, I actually have a canal back here. It's a continuation of the vertebral canal. So I'm able to put my stick in a little bit. I see some of you guys have a model where it's all filled in. You can't, that should be a canal. So in your book, this is the entrance to the sacral canal. You should be able to stick your stick through. It should come out the bottom. But they didn't do that on our models. They filled them in for some reason. So this is the entrance to the sacral canal up here. The opening where my pointer finger is at the bottom, that opening is the sacral hiatus. So this right here is a great picture. This opening here is the sacral hiatus. The last spinal nerve comes out of there. All right, we'll see there's 31 spinal nerves in a couple weeks. One spinal nerve, the very last one, is going to come out of that sacral hiatus. Okay? Now watch this, guys. If you see your model, on either side of the sacral hiatus, there's bumps. Bump here, 2 over here. These are the sacral cornu. In Latin, cornu means a horn. So it's kind of like a horn sticking up. So that's the way the anatomists looked at it. So they call these the sacral horns or the sacral cornu. Okay, sacral hiatus in the middle, cornu on the sides. Okay, this thing. If you feel in the midline of the sacrum, this model I have right here is good. This is the median sacral crest. What do you think this was? The 5 vertebrae fused together. What do you think this ridge of bone was on the individual vertebrae? The spinous processes, very good. This is all the spinous processes fused together from the 5 vertebrae. So that's the median sacral crest. Okay? If you go to the side a little bit, right here, again, each model is a little bit different as to how well it is. Right here, this ridge going up, and this ridge going up right here. This is the lateral sacral crest. Mine is not that great on this, right where my fingers are here on the left. Again, they're all a little bit different. That's the lateral sacral crest on one side. You have them on both sides. What do you think that was? What fused together to form the lateral sacral crest? Say it. Transverse process, very good. The transverse processes stick out to the side, so they all fuse together to form the lateral sacral crest. Okay? Now, you'll see the sacrum in the back as well as the front have 8 holes, a bunch of holes. So these are sacral foramen. Right? We'll see as we go on the nerves that come out of the back, and then there's going to be some nerves that come out of the front. So these would be the anterior sacral foramen. In the back, we would just call these posterior sacral foramen. But even if you just said to me sacral foramen, I would be okay with that. Just a hole in the sacrum. Okay? So let's review. You tell me, what's this opening up here? The sacral canal, good. And it opens at the bottom at the, not the cornu, sacral hiatus. What's on the side of the hiatus are the cornu. What's this line coming down the middle here? Median sacral crest. Out to the side, lateral sacral crest. Okay? The holes coming out the back, sacral foramen. Sacral foramen. Good. That's most everything. In the front, what are the wings called? Ala, right? A-L-A. And then this part that sticks out right here, promontory. It's like prominent. It sticks out, so it's prominent. Promontory. Okay? Good. Now, if you look at the side of the sacrum here and the side of the sacrum here, I'll show you a picture first. Check this out. They do a pretty good job with this. This thing right here we're going to look at goes like this, up and around like that. Kind of looks like your ear. This thing here, this is called the auricle. Kind of looks like that. So look what they call it, the auricular surface. It kind of looks like the ear. So if you know that the auricle is your ear, it kind of looks like that. This is the auricular surface. Right on the sides, we have one there and one on this side. Our hip bones I'll show you right here actually. Our hip bones are going to, our hip bones, one ilium on the right, one ilium on the left, is going to articulate with the side of the sacrum, right? You kind of picture your pelvic bone sticking out. So these are the auricular surfaces, okay? Here's what it looks like. And I'll show you this next week. But you can see the auricular surface articulating with this hip bone right here. This bone is called the ilium. All right, I'll show you that. We'll work on this next week. So here's your ilium articulating with the sacrum. I forgot to say this also. I have it in the notes. The sacrum articulates with both ilia. It articulates with L5 above. What does L5 mean to you? Lumbar number 5, right? As silly as it may seem, right? We're talking about the 5th lumbar. And then the tailbone at the bottom. What's the tailbone called? Below the hiatus. What's the bone called? Coccyx, right? We're going to do that one next, the coccyx, okay? So the sacrum is articulating with 4 different bones. L5 above, each ilium, that's 3, and then the coccyx below, okay? Any questions on the sacrum? It's a nice, easy bone. That's a station also, guaranteed, guaranteed. Okay, guys, for the coccyx, do me a favor. I put there that the letter, no, I'm sorry, number 1, the coccyx consists of between 3 and 5. Cross that out. Just make it 4. If I ask you how many vertebrae made the coccyx, we're going to go with 4. It's variable, so just put the number 4. Take out 3 to 5. So if I ask you, I don't want to hear 3 to 5, I want to hear 4. We're going to go right in between. Okay? I see some of the sacrums don't have coccyxes on them. So just to show you here from a picture, just like the sacrum, the coccyx is a triangle. So the flat part would be the base, the pointy part would be what? The apex. And the same as the sacrum, the base is superior, the apex points down. Right? So the coccyx points down. And again, you should know it has 4 parts to it. 1, 2, 3, 4. On this picture, they just show you some horns that stick up. Guess what they call the horns? Cornu. You don't even have to find them for me. Just know that those facts. 4 segments make up the coccyx. The apex faces up. Wrong, right? The base faces up. The apex points down. Okay? I'll be happy with that. Questions or comments? You hanging in there with me? So far, so good?
Yep.
All right. This week is easy. Next week is the bitch. And I would suggest you be here, guys. Come a little bit early. You guys are coming in a little bit late. You're going to miss a lot of important stuff in your test the next week. So try to be here by 8. I'm going to start at 8. We have a full class next week. We're doing arms and legs, so it's a lot of information. So try to be here on time if you can. Let's go to page 4.
Oh, good.
We'll take a look at the thorax. So, we did thorax. So the thorax, guys, refers to the entire chest. If you were to look at a patient, say you're going into nursing, that type of thing, you're going to be a PA. When you look at the chest from the side like this, it's flat in the front and it's flat in the back. Again, partly because look at the spinous processes, it's kind of flattened out. So when you're actually learning to do a physical exam and you're learning to assess somebody's chest, it should normally be flat here and flat here. With different pathologies, diseases, the chest can change. It actually, would be an example. Have you guys heard of emphysema? Remember when people smoke sometimes for a long period of time? These patients can get air in pretty easy, but they can't get the air out. So the chest fills with air, and over time, the front and the back of the chest wall become out here. They're actually out here. And the chest has a round appearance. We call that a barrel chest. So these are things you're going to look for as you assess a patient. So it should be flat. It should be flat, right in the front and the back. Okay? Number 2. The thoracic cage consists of the thoracic vertebrae, so all these thoracic vertebrae, we just studied the 12 of them, the ribs here, and this breastbone in the front called the sternum. Right, so the thoracic cage is all of that. The vertebrae, the ribs, and the sternum. What's it doing? Under here we have some important organs. What are the two organs that would sit on the side here where my fingers are? Lungs are going to be there. In the midline is the heart. And then remember from lecture number 1 or lab number 1, the rest of the mediastinum, that midline wall, trachea, esophagus, the great vessels. Those are things we looked at in lab number 1. All that stuff is protected pretty well by the chest, by the thoracic cavity. Okay. Number 3. If you're just talking about the ribs and the sternum, no vertebrae, we then call that the thoracic cage, right? So just this, the ribs and the sternum without the vertebrae, you can refer to as the thoracic cage. Okay, take this bone out right here.
Oh.
Okay, so watch this. Our sternum, just to show you what this model is, so right here, guys, in the midline, this is the breastbone, the sternum. These right here are costal cartilages. Again, what does costal mean? Rib, pertaining to the ribs. So these are cartilage that are going to attach to the rib. These are not the ribs. The ribs, if you look up over here for a second, the skeleton does a good job at this. The ribs come up maybe to about here. Now the cartilage brings the rib to the sternum. So this is connecting the rib to the sternum. So these are your costal cartilages. That's what's shown on this model right here. Okay. We're going to divide the sternum into 3 parts. This top part here where my pointer finger is, guys, is the manubrium. This middle part right here is the body. And then this pointed part right here, xiphoid. So manubrium, body, xiphoid. Let's look at some of the parts. We'll start with the manubrium first. So that's the top part. So we're going to see next week especially your collarbone. What's the collarbone called? Clavicle, thank you. The clavicle articulates with the manubrium right over here. So take your fingers for a second, go to your collarbones, your clavicles, walk medially until you meet your sternum, and then just kind of go like this. You can feel the movement of your collarbone, your clavicle on the sternum. Your clavicle is going into a notch right here where my 2 fingers are on the side of the manubrium. They are called the clavicular notches. They're going to receive the collarbone on the left, the clavicle on the left, and the clavicle on the right. So where you were feeling is where your collarbone goes to your manubrium. Those are the clavicular notches. On the top of the manubrium, our model's not that great. There's a notch that goes in right where my pointer finger is. Actually, you can probably feel it on yourself. If you go to your manubrium for a minute, push in gently, because we got some major vessels there. We don't want to hurt yourself. Push into the top of your manubrium. If you push down, you feel that little indentation? That is the jugular notch. Our model's not that good. It's kind of flat. It should be more indented. That's the jugular notch. Even my picture is not that good. But I can feel it like on me. It kind of dips in, right? Jugular notch. Clavicular notches, jugular notch. Now, there's a little prominence where the manubrium meets the body. This little prominence right here where my pointer is, this is the sternal angle. You can feel it. If you kind of go from your manubrium down and you go to here, like I can feel mine, it sticks out. I'll tell you why this is important. If you guys ever have to count ribs, either for, say, you're listening to somebody's chest and you want to have your stethoscope in the correct rib space, or you're putting on EKG leads, or you're doing a thoracocentesis where you're sticking a needle into somebody's chest, you got to be in the right place, right? The sternal angle automatically brings you to rib number 2. So if you go to the sternal angle, And you can feel it on most people, whether they're big, heavy, muscular. Most people are bony right here. You can't miss it. So you go down here, you feel the sternal angle, you come out, you know you're on rib 2. Now you can count 3, 4, 5, 6, 7, 8. Because counting ribs is so difficult. It was one of the things I found to be the most difficult to do was to count ribs. Okay? So sternal angle brings us to rib number 2. The rest of this is the body. Okay, that's easy. The body is all this. And then again, what's the point? Apex, or we're going to call it the xiphoid process. It's got a name, the xiphoid process. Those of you that ever took a CPR class, right, when they teach you to do chest compressions, that the patient's laying here, they always say, find the xiphoid process and then go 2 finger widths up and push on the body. Because what happens if you push on the xiphoid? It's going to break. And you know what's going behind there? The liver. You could lacerate the patient's liver. Again, so they survive. Now you messed up their liver on them. But we want to be above that. It's probably a painful thing too, I can imagine. Okay? So manubrium. What are these 2 notches here? Clavicular notches. Good. What's a notch on the top? Jugular notch. What's the angle? Sternal angle. Good. What's the main part? Body. And the point? Xiphoid process. Right? It's spelled with an X. And I think that's it for the sternum. Any questions on that? This is a station also. Right? Very easy. Jugular notch? Yep. Jugular notch is on top. So this would be the jugular notch. These 2 here on the side, clavicular notches. Clavicular. Right? Jugular on top, clavicular. The clavicles coming on the side. Which one? Sternal angle, where the manubrium meets the body. So it's a little bump right here, where the manubrium meets the body. We used to call it, when I was in school, they call it the angle of Louis. That was the term, but we're kind of switching it off. Did you ever hear that? That's what they're talking about. It's the sternal angle, right? The angle of Louis. Okay. The last thing I want to cover with you as far as new material today, guys, are the ribs. Let's take a look at the rib cage. So again, one more time. How many thoracic vertebrae were there? 12. That means there are how many ribs? 12 on each side though. So you got to say 12 pair, right? Or 24 ribs if you want. But there's 12 pair of ribs. So each thoracic vertebrae, if you look at the skeleton, put this back over here for a minute. If we look at the skeleton, each thoracic vertebrae has a pair of ribs coming off of it. We can classify ribs as either true or false. So watch how this works. We'll look at this from the front for a minute. We'll turn his head a minute. Ribs 1 through 7. So let's look at those. Rib 1, 2, 3, 4, 5, 6, 7. These 7 ribs all have costal cartilages that make a direct connection to the sternum. Right, since there's 1 costal cartilage per rib, they call these true ribs. However, take a look at 8, 9, and 10. Those 3 ribs have a common branch bringing them to the sternum. There's 1 branch for 3 ribs, so those ribs are classified as false ribs because they have 1 common branch. I would take a picture of this skeleton here for this section. If you're taking pictures of your bones and stuff, take a picture of 8, 9, and 10. They have like 1 common branch right here that are bringing the rib in contact with the sternum. Let's bring it back over here so everybody can see. So on this side, let's bring it right here. On this side, see this 1 branch bringing these 3 ribs? 1 branch bringing these 3 ribs? They are considered false for that reason. Watch this, 11 and 12, if I go back a minute, 11 and 12, 11 doesn't go maybe halfway around the chest, 12 stays back over here in your muscles, so they don't even touch the sternum. So they're false for that reason. we call ribs 11 and 12 floating ribs because they're not attached to anything in the front, okay? So you tell me, ribs 1 through 7 are what ribs? True. 8 through 12 are false, and then we can say 11 and 12 are floating, okay? Does that make sense? And again, they just don't come to the front. They kind of hang out back over here. They're actually in your muscle. They're pretty well embedded in the muscle. So those you can call floating ribs. Yep.
I always wondered, why do we have like 11 and 12? Why is it
Yeah, you know, we probably really don't need them. They don't do much. They're stuck in the muscle. They don't really do much.
Why do we have this? Did we used to use this?
We used to,
before?
when you had a tail, we did, yes.
Seriously, we
Yeah,
had this?
we had a tail. So we don't, maybe, you know what? Maybe hundreds of thousands from years from now, our ancestors won't even have a coccyx.
Yeah, I always wondered, like, why do we have that little piece of?
It's a remnant, it's a remnant,
Oh,
okay? And ribs 11 and 12, they anchor some muscles, but they really don't do much as far as breathing and things like that. Like these other ribs will move for breathing. These really don't do a whole lot. They don't do a lot, okay? The last thing is, so now we know true and false. Most of this we know already. Let's take a look at the parts of the rib that you have to know. Right here. Let's start with this, because this picture's familiar. So remember we said before, the head of the rib goes to the costal facet. So this is the rib head. Now watch this, we're gonna see this a lot next week. Just like us, underneath our head, what structure is there? The neck. So this constricted part right here under the head is the neck. The head, the neck. What was the bump? The tubercle. So the head, the neck, the tubercle. Now check this out. Our ribs, the head, the neck, and the tubercle are back over here. Then the rib kind of runs backwards here, like flat in the back of the thoracic cavity. But watch what happens then. The rib changes direction. It starts to come to the front. Where the rib changes direction to move forward, that we call the angle of the rib. So here, see how the rib is changing direction? Like on me, the rib is flat back here. Then it starts to go forward on you also. This area here where it's changing direction to come forward, that is the angle of the rib. So this bend right here, guys, you're gonna call the angle. Head, neck, tubercle. The next thing is the angle. Head, neck, tubercle, angle. The main part of the rib, if you're holding the rib kind of like this is the body of the rib. The body of the rib, okay? And then over here, where it's going to go to the costal cartilage, just call this the sternal end. I think that's what I put in the notes. I just updated this. So this would be the sternal end, okay? Head, neck, the bump is the tubercle, the bend is the angle, the body, sternal end. The last thing, again, some models are better than others. On the underside of the rib, this one here I can see it at the angle, that's about it. There's a groove. It's called the costal groove. Some blood vessels and nerves actually run in that costal groove, so all of this is the costal groove. Like I said, on this model here, I see it best at the angle. I lose it once we get to the body. It's there a little bit, but it's not as defined. So you should know the costal groove is at the on the underside, okay? And I think that covers everything for a new material. So let's see how much time we got left. What time we go to? 1:45? So you got about a half hour. Say 25 minutes. Take this time, guys. The skulls are in there because you're not going to see them again here. Next week we're doing arms and legs. If you want to review the skull bones and the face bones, the vertebrae, right, we have about 25 minutes. So take that time and then I'll answer questions. Yep. Take pictures.